Okay, so do you know that there is such a thing as, oops, there is such a thing as DKA with euglycemia, meaning DKA, diabetic ketoacidosis with euglycemia. So the blood sugar is normal. It's not really that high. Usually, we look after DKA patients. Patients with DKA usually has hyperglycemia, so blood sugar is high. But so there is such a thing as DKA with euglycemia. Hooray! So that's a new thing. I've always looked at after patients with DKA a lot of times, and they're always hyperglycemic. Okay, so first of all, what is DKA? Well, for nurses and doctors, we all know about it, diabetic ketoacidosis. And usually they are hyperglycemic. So what is the criteria for that? So one, diabetic. The patient is diabetic. Two, of course, so because diabetic, hyperglycemic, so blood sugar is high, and then pH, when we do the blood gas, would be like more on the acidotic side. So what is the pH normal value? So it is 7.35 to 7.45. So below 7.35, it's considered acidotic. And then the bicarb has to be low as well on the acidotic side. So what is the normal value of bicarb? So it is 22 to 26. So below 22, then the patient is acidotic. And then of course hyperglycemia and blood sugar should be high, usually above 13 and all that. So yeah, usually above 13. And then, of course, the presence of ketones. That's why it is diabetic ketoacidosis, because there is the presence of ketones. Usually they have high ketones. And so that's it. pH on the acidotic side, bicarb low, kaboom, it's metabolic acidosis. And then hyperglycemic, and then ketones present, so kaboom, metabolic acidosis, secondary to DKA, so diabetic ketoacidosis. So there you go. I was just fascinated that I have looked after somebody with DKA and yet the blood sugar was normal. So apparently there are some people who are diabetic who can have that DKA with euglycemia, meaning the blood sugar is not that high. So there are apparently medications that can cause it. So some diabetic patients are taking some medications. I just forgot the name of that medications, but I will later on come back to that. And then apparently some pregnant women with type 1 diabetes and all that I have to make sure about that as well. So yeah, I was just trying to say that whoa. So there is such a thing as TKA with euglycemia, not just hyperglycemia, but euglycemia, meaning normal blood sugar. So please comment. I want to learn from other people about that, if they can comment whether I'm just talking bollocks, maybe. Anyways, then we can learn from each other. But yeah, that is apparently that is true. So anyways, please comment on this, and voila, next time I'll get back to you about the causes of those. Okay, bye for now.